Midwife Jean Kavanagh and mental health nurse Audrey Shaw explain how they became registered nurse prescribers.
There's a big team of midwives here who are prescribers, and it was very much encouraged throughout the hospital. So it was suggested, and I thought it was a fantastic idea because I saw the impact it had on patient care. So I applied for the course.
I'm a staff nurse with the community mental health team called the Home Based Team, which basically takes care of people at home rather than hospital. And the reason I decided to do the nurse prescribing was because we cover a huge geographical area, and you find yourself in situations assessing a patient and there was a clinical indication that this person was in acute stress and they needed medication. So before I did the nurse prescribing, you would have had to go back into the hospital, talk to a consultant, get a prescription, go back out. It could take you up to 2-3 hours. Meanwhile, the patient is distressed at home and family obviously as well. So now it's quicker response for the patient, their anxiety is alleviated, and it's better care for the patient as well.
It was a 6-month course. I did it in the RCSI here in Dublin. It involved academic and on-the-job training as well. We were very much minded here in the hospital, like we were very lucky because there was so many midwives already prescribing, and our mentors were very involved in the whole time of our course. I started the course as a staff midwife, and I was kind of a little bit uncertain at the time. I thought it might be a bit too academic or a bit too difficult for where I was at the time, but because of all the encouragement we got from my colleagues and from my mentor, it made it really enjoyable experience, although it was tough at times.
Perfect. I thought there would be a lot of CNSs, CNN2s, and as a staff nurse would I be able for it. But I went ahead anyway and had a lot of support from site coordinator and my director of nursing and the consultants as well. My mentor would have supervised me on assessments of new patients. She was hugely supportive, but there was a lot of communication then between the other consultants as well, so everybody was aware of what stage I was at, what was expected of me and of them.
I definitely feel that patients get a more holistic kind of care. We can deal with them straight away, like there's no kind of time wasting. We can see a patient and we can treat them at the time that it's needed. I think it hugely impacts their care and like their whole experience in the hospital, especially with regards to pain management. Midwives are here on the unit 24 hours a day, so there's no kind of time delay regardless day or night. The patients get to know you very well, like you're dealing with them on a one-to-one basis. They know you and they can kind of, I feel like they can ask more questions, that they're not afraid to approach you with any queries or any concerns that they have.
When you're looking after somebody at home, you get to know them a lot better. Obviously, if they're in their home environment, they're a lot more relaxed. So you build up a good relationship. You can spend an awful lot more time with a patient, and there's a lot of education can be done around medication management. You can give them more treatment options as well. You know, if they're unhappy with a certain medication, you can offer another, and they become active participants in their treatment rather than passive, which happens quite a lot in mental health. I think nurse prescribing is definitely the way forward for nurses. It's natural progression for nurses, and I'd say to anyone to go ahead and do it. It's enhanced my job definitely, and more importantly for the patient.